Hold on, stop scrolling. If you care about the future of our world, give us a minute of your time.
We would like to think that the future would include happy and healthy children who live in a world where it's easy to make a healthy choice.
Unfortunately, right now, 1 in 3 Caribbean children is overweight or obese. And without effective policy, this is projected to reach 50% by 2030.
If you're still listening, that means that something we said stood out. Keep listening.
As young people passionate about health,
we want to bring awareness to what can be done to protect the future. Us.
Specifically, policies that can help create a healthy school environment.
A school environment that is free of sweet drinks and the influence of the ultra-processed food industry.
We need protection from the pervasive and predatory marketing strategies of companies who use us, children, and young people for their unhealthy products.
Would you want these type of foods to be marketed in schools or made easily accessible to us as children and young people?
so really, what are we asking for?
Really, what are we asking for?
So really, what are we asking for?
A healthy school environment.
A healthy school environment.
A healthy school environment.
A healthy school environment.
We're calling on all youth to take charge as stakeholders in their health and to use their voices and platforms to amplify these messages.
We are all calling on governments and NGOs to ensure that we, young people, are engaged meaningfully at all stages of any action on the future of our health.
We have power.
We have power.
We have power.
We have power.
We can make a change.
We can make a change.
We can make a change.
Let's unite
For a healthy and safe future.
Let's unite for a healthy and safe future.
Let's unite for a healthy and safe future.
do this for us.
It is my pleasure to welcome you to today's webinar, the fifth in a series of NCD and COVID-19 webinars hosted by the Healthy Caribbean Coalition. Today's webinar will focus on the important topic of the relationship between nutrition, obesity, and overweight and the COVID-19 pandemic. The pandemic has raised fundamental NCD concerns. Protracted periods of lockdown has resulted in disruption of services for prevention and treatment of NCDs, challenges in being physically active, isolation leading to increased mental health issues, lack of easy access to healthy food, and the increased influence of the unhealthy food industry. These are all expected to contribute long-term to an upsurge of deaths from NCDs. The reality is the pandemic is likely to exacerbate an already urgent situation in the Caribbean region, where 1 in 3 children are obese or overweight, and up to 2/3 of adults are overweight or obese. Physicians and nutritionists across the region are increasingly worried as they begin to see emerging patterns of weight gain and other NCD antecedents, both among children and adults. The recent report from the University of North Carolina that being obese doubles the risk of hospital treatment from COVID-19 and increases the risk of dying by nearly 50% is truly alarming. And so the themes that will be explored during today's webinar will include the relationship between COVID-19 and obesity, factors that contribute to pandemic weight gain in children and adults, the role of the food and beverage industry in the obesity epidemic prior to and during COVID-19, and implications of weight gain among children and adults on COVID-19 and NCD risk. And so it is in that setting and in that context that I now invite our Executive Director of the Healthy Caribbean Coalition, Maisha Hutton, to give her welcome remarks and chair the webinar. Maisha.
Good morning, everyone. It's such a pleasure to be here. I'd like to thank our colleagues at the Heart Foundation of Jamaica and the Heart and Stroke Foundation of Barbados for being partners on this webinar. We have a tight agenda today, so I'm going to get started with our first presenter, Ms. Zanik Edwards. She is a youth advocate hailing from St. Lucia. Zanik was diagnosed with type 1 diabetes at the age of 16. Although she has a self-professed love-hate relationship with diabetes, this diagnosis continues to provide the impetus for her work as a diabetes youth advocate. She has served as president of the Youth Diabetes Foundation and has represented her homeland as a young leader in diabetes in Abu Dhabi. Zanik is going to share her personal story of living with NCDs during a global pandemic. Zanik, the floor is yours.
Good morning. Can everybody hear me?
Yes,
hello?
We can. Yes,
okay.
We can hear you.
First, I'd like to thank everyone for this opportunity to engage and share with you my experience living with type 1 diabetes during the COVID-19 pandemic while living in St. Lucia. So as Maisha said, my name is Zanik Edwards and I am 29 years of age. I am insulin dependent and I do a basal bolus insulin therapy. This is where I take an injection with every meal. So let's jump straight into it. Even before our island went on lockdown with only one COVID case on island, at the time I was already overwhelmed with anxiety. With all this talk in the world about stopping flights and hearing stories about persons I know personally living with diabetes in other places of the world having to ration their insulin, I became consumed with worry. I was concerned about not getting access to my insulin and not being able to order in my different medical testing supplies. So while the world went on a rampage for toilet paper, I went on a rampage for trying to get medication, at least 6 months supply of medication and testing supplies. With the help of my team, and when I say team, I'm not only talking about my physician, my employer who had to give me time off, family and my friends, I was able to put all these worries and concerns to rest and acquire enough medication for a 6-month period. So let's fast forward to quarantine. During COVID-19, I became almost committed to a sedentary lifestyle. I went from engaging in daily physical activity to laying on the couch and watching Netflix all day. And this was accompanied by some of my favorites, but bad, high carb, high salt snacks. And for me, snacking came with weight gain and increased blood sugar readings. Not being happy about the weight gain, I decided to change my approach. And I figured that the best way to approach living was to build my immune system to prepare me to be able to fight anything. I decided to eat healthy and really try to commit to regular physical activity. The problem for me is not starting, but having the discipline enough to stick to it. So I gradually reduced my snack consumption and started to research the benefits of different foods. I would normally eat small portions of salad, but I was not someone who would choose a salad. And that started to change. So I started to choose having a salad and reducing my carbohydrate intake. A bonus to this experience was me signing up for a backyard gardening project that was ongoing by OECS and HCC, which basically encourages individuals to grow their own food and eat healthier. At the time, I had absolutely no experience in gardening, but I thought with our current times and possible food crisis, this would be very relevant. So the whole idea behind going to your backyard and harvesting exactly what you need, like tomatoes, kale, your lettuce, your cucumbers, to make today's salad was really rewarding for me. However, making these adjustments, though I was making healthier choices, that came with its own challenges, as now I had to make adjustments to my medication doses to properly match my food consumption. This entire time has afforded me the opportunity to truly experiment with food and to discover how my body reacts to different foods. Living with and managing diabetes can become quite challenging. So what may work for me may not necessarily work for you. So this has truly allowed me to further discover myself and become more aware of the way my body works. Thank you.
Thank you, Zanik, for sharing your story. I think a lot of us can relate to some of the experiences that you've had. And I think we have a lot to learn from your perseverance. I was particularly impressed with the backyard gardening and your commitment to make a change to your diet. So let's move ahead on now to Dr. Suzanne Soares-Winter. She is a clinical nutritionist, a researcher, and lecturer at the Caribbean Institute for Health Research at the University of the West Indies in Kingston, Jamaica. Her current research focuses on school nutrition and the general food environment for the purpose of developing strategies aimed at reducing and preventing obesity. Dr. Soares is going to speak on COVID-19 and obesity, implications for diet and nutrition in the Caribbean. Dr. Soares, please go ahead.
Hi, good morning, everyone. Okay, so yes, as was said before, COVID really appears to be a moving target, and every one of us seems to be at risk. And because the pandemic has triggered a wide range of events, that affects our dietary patterns and our health status, this has influenced our response to COVID infection. But the reverse is also true, with COVID having an indirect risk effect on our diet and obesity, and it has implications both in the short and long term. So I'm going to try and explain some of the situations that will occur, and it really determines how well we fared during the pandemic. Next slide. So there's growing evidence that becoming obese or being obese and having pre-existing illnesses that are associated with obesity carries a greater likelihood of complications, hospitalizations, and fatalities due to COVID, as was said earlier in the introduction. But what's the nature of this relationship? Firstly, consuming an unhealthy diet and having an unhealthy lifestyle, being inactive specifically, are the leading risk factors for obesity. Also, there are actually some nutrients and foods such as alcohol, salt, and excess sugars that can hinder our immune response even within hours after consuming them. And so over the long term, this results in an accumulation of excess fat and body weight, which can cause impairment and damage to nearly every organ system in the body. As a result, because of inflammation and so much of this damage, what it can do is it can have a profound effect on our susceptibility to infections like COVID. Next slide. We can also consider a reverse relationship where perhaps having COVID and within the pandemic, that it's enabling an unhealthy diet and diets, our lifestyle, and our risk of obesity in the reverse. So ever since about March, when COVID really started to have a presence in the Caribbean, we've heard about border closures, job losses, curfews, stay-at-home orders, and a series of events that really have led to disruptions in our usual food supply chains, whether at the home level, within the community, and even on the larger scale at the national and regional levels. So, for example, within a household, a lot of the various fairs have limited shopping opportunities. And so we may not be able to access the type of food that we want. Also, we've heard of panic buying, and that may rely on processed foods, storing of processed foods. So consumers' meal patterns, as well as their access, availability, and affordability of healthy food may have been challenged. We have reported behaviors of persons stocking up on fast foods. Because of the depression that goes along with COVID, their emotional eating and possible excess alcohol use. Unfortunately, because in the Caribbean we have extremely outdated health and nutrition policies, it may actually be difficult to engage appropriate control mechanisms. And some of these I'll go on through in my next slide. So what are some of these unintended or intended exposures? We'll notice that the pandemic has created a flurry of food industry marketing and donations, which have created a reliance on low quality, unhealthy products. So throughout the news, we've heard reports of long lines at fast food drive-thrus. Many fast food companies are now delivering to home because we are more at home. School children, the elderly, poor relief groups, and even our most important frontline workers have been receiving donations of fast food meals, sugary drinks, and other unhealthy products. On another scale, we have a lot of the alcohol companies that are now doing sanitizers because they're necessary. But think about the branding of those sanitizers if they enter a school system. So while many of these may appear charitable and provide us a quick stopgap for vulnerable groups, especially children, this is really a threat to food insecurity and has implications for obesity and risk of illnesses like COVID later on in life. Next slide. So why is this important for us here in the Caribbean? As we heard, for most countries across the region, there is sufficient evidence showing that 1 in 2 adults and up to 1 in every 3 children are already overweight or obese. And we know that these accompany very high rates of NCDs, the non-communicable diseases, and other issues. And so the risk factors for these have been quite simple. Existing risk factors, we know that drinking even just 1 sugary drink per day, eating fast foods a few times a week. Most countries across the Caribbean report very low intakes of fruits and vegetables, below recommendations. And we generally are a sedentary group, not doing much moderate or vigorous physical activity. We also have to look at the other side with micronutrient deficiencies. We still have anemia quite common, especially in our younger age groups. And we do have not severe malnutrition, but we do have undernutrition. And we know that undernourished children do have a higher risk of becoming obese adults. I put depression here because the pandemic has created a lot of mental illness in terms of stress and depression, and that can lead to emotional eating. Food insecurity, prior to the pandemic, quite a number of the population was already food insecure, up to 60 and 70% in many countries. And so I hope you notice that essentially a lot of the same elements that I spoke about that impact our immune system will impact our risk of obesity. And what this therefore means is that prior to the pandemic, many of us were already in a crisis and at high risk of COVID. Next slide. So while the pandemic might have brought positive changes in terms of, improvements to the agri-food industry, getting farmers' produce out because of closures in the tourist and business industry, it really has brought a reliance on non-perishable packaged foods. And so it's important to understand some of the changes, the choices we have as consumers. So in a recent study, just looking at the retail food landscape, looking at the variety of foods and beverages that are available, we examined just over 6,000 products, looking at prepackaged foods. And what we noticed from this slide is that most of what is here is very ultra-processed foods. And just looking at this as a proxy for demand, we see that most of these are beverages, candies, sauces and spreads, and snack foods. Also want to mention that a good 12% had erroneous labels. Next slide. Looking at the content, the nutrient content of these foods using the PAHO nutrient system, we can see that except for 100% juice, including coconut water, the majority of these beverages, these products, more than 60% and even up to 98% of these products had high amounts of excess unhealthy nutrients, namely sugar, salt, and fat. And so you can see that consumers have very little choice out there. Next slide. And so because COVID may be around for some time longer, we really have to think of a health-focused environment and striking a comprehensive balance. Having a more nutrition-based diet, limiting ultra-processed foods, becoming more active, looking at farming initiatives. We definitely have to look at corporate social responsibility and address the marketing, ensure meal support programs and mental health is addressed, and ensure that control mechanisms are in place. Last slide. And so we really want to, at the individual level, optimize nutritional status and immune protection and secure a healthy food environment with our individuals right up to the regional level and support policies. But most of all, we must protect our vulnerable groups. Thank you very much. That's it.
Thank you, Dr. Suzanne Soares-Winter. That was an excellent presentation. I would like to remind everyone to please use the question and answer feature. You can type your questions in there and our panelists will take a look and they can respond to your questions. Next, we have Professor Anne St. John, who is a pediatrician. She is also an honorary professor in child health at the University of the West Indies Faculty of Medicine in Barbados. She's an honorary consultant in the Department of Pediatrics at the Queen Elizabeth Hospital here in Barbados. And she is currently the medical director of youth health with the Heart and Stroke Foundation of Barbados. And she operates a private practice in pediatrics. Professor St. John is going to speak to us on children, overweight, obesity, and COVID-19. Professor St. John, please go ahead.
Good morning. I'd like to thank you and the HCC for allowing me the opportunity to make this presentation today. The next slide, please. An estimated 1 in 3 children in the primary school setting in Barbados is overweight or obese. And this experience, as reflected by a prior speaker, similar to other Caribbean countries. These two non-communicable diseases in particular are affecting an increasing number of students. And other NCDs have far less prevalence. Next slide. Some of the factors influencing the balance have been highlighted as being environmental, cultural, biological, genetic, changing lifestyles and physical activity. And it should be noted, as we are aware, being obese increases the risk of non-communicable diseases such as diabetes, heart disease, stroke, arthritis, and some cancers. Next slide. In the pre-COVID-19 consumption, a study done by the Healthy Caribbean Coalition reflected that 18.5% of students ate fast food 3 to 4 times a week. 73.3% reported drinking 1 or more carbonated drinks per day, and 15% had no vegetables or fruits in the past month. And this slide does reflect the main appearance of their diet. Next slide. Pre-COVID as well. Here shows some reflection of the consumption of various foods in all countries on the left and Barbados on the right, showing that the obvious consumption which stands out is sugar sweetened beverages in the dark red. All countries on the left showing that on the right in Barbados, it's about 3 times the amount of sugar consumed, sugar sweetened beverages, and the other intake was very similar in the countries. Next slide. Our messages from Heart and Stroke Foundation into the community consisted of high-profile messages trying to compete with the marketing strategies which seem to predominate and have a tremendous effect in the unhealthy nutrition which students were adopting. Needing more water, looking at reading nutrition labels and alternatives to sugar-sweetened beverages with our Switch It Up campaign. Next slide. Sensitization also involved looking at healthy lifestyles of nutrition, the 5-4-3-2-1-0 guideline on the right, and portion controls using your hand, which is practical, instead of advising about ounces and grams, because one doesn't carry around a scale, normally speaking, in everyday life. Our next slide. So I'm going to share with you a bit about the concept of the Model Schools program, which was introduced in Barbados, a consortium of various organizations and looking to involve model schools. There were 6 model schools, 4 secondary schools and 2 primary schools, 1 private, and the rest were government operated schools where there's free education. And the principals signed a memorandum of understanding with the Heart and Stroke Foundation to participate in this program, which was being introduced. Next slide. And what was the concept of the Model Schools program? The goal was the restriction of beverages with added sugars by the new school year, with a major change in attitude. Secondly, to build out a health club in each school, including aspects of education and fun activities, indoor and outdoor, to get them moving. And thirdly, public education to conduct sensitization activities with parents, teachers, the vendors at the school and outside the school, and the students. The next slide. The strategies involved maintaining, mainly reducing body mass index at the individual level with monitoring, evaluation, and implementing specific measures, inclusive of nutrition counseling. And coming out of this, we have a Heart and Stroke Foundation of Barbados youth gym, where there's exercise by prescription, physicians, clinic doctors in the private and public setting, healthcare workers, and schools. Parents as well can approach Heart and Stroke for their overweight or obese child to be enrolled in a structured youth gym, which operates on Saturdays. And these were introduced also to the model schools, where we had regulation of sugar-sweetened beverages, physical activity, and introduction of school gardens in some of the schools where it was practical. Next slide. We also implemented evaluating the program, looking at the effect on the canteen operations, effect on vendors, because workshops were held for canteen operators and vendors in and outside the schools, and auditing the schools at various points, interviews with the heads of the PTAs and the principals, and monitoring of selected students. Next slide. So enter COVID pandemic, and this is like a spoke in the wheel. There was our program which was being adopted, progressing a reasonable level, and COVID entered early 2020. Now, it has been shown the lockdowns implemented across the world have negatively impacted diet, sleep, and physical activity among children with obesity. A study which was conducted in Verona, Italy, only 41 students, but it was quite informative. It was done by University of Buffalo researchers and published in Obesity in April 2020. The study findings reflected that children ate an additional meal per day, slept extra half of an hour per day. They added nearly 5 hours per day in front of the phone, computer, and TV screens, dramatically increased their consumption of red meat, sugary drinks, and junk foods. And the amount of vegetables consumed remained unchanged. However, in our setting, anecdotally, I would consider that our vegetable consumption probably, based on a baseline pattern of observation, that the vegetable consumption also decreased. The next slide. The study findings also found that physical activity decreased by more than 2 hours per week. And we're already struggling with students who are not motivated to participate in their usual recommended at least 1 hour of physical activity per day. There were negative changes in behavior indicating that children with obesity fared worse on weight control lifestyle programs while at home compared to when they were engaged in the curriculum at school. And these are all corroborated anecdotally by our local pediatricians' observations. So there was definite increases in weight during the COVID pandemic. Next slide. What are some of the future trends since COVID-19 is here for an uncertain duration? The Heart and Stroke Foundation has recently launched, within the last couple of weeks, an Act Now campaign in the prevention of childhood obesity. It is now time to act. Next slide. So some of the post-COVID guidelines for children include increasing use of telehealth, monitoring the BMIs, health visits more often than once a year, maybe twice or 3 times, to the pediatrician clinic or general physicians, weight, height, and BMI data collection, monitoring academic education and psychosocial health aspects, keeping current with their immunization, because we know students who are not immunized up to date sometimes are more susceptible to NCDs and diseases acutely, counseling parents to detect, address issues, and focusing on introducing virtual healthy lifestyle programs so families can be advised on taking appropriate choices during and after lockdown periods. Last slide. Here is my reference, as I mentioned, from the study which was conducted in Italy by the University of Buffalo researchers. And maybe it would be worthwhile for many areas in the Caribbean to conduct a similar bit of research to see how it individually impacted our territories. Thank you. In closing, I would like to thank those participants who have joined today's webinar. And I hope that the message taken away here is COVID is here to stay, and we definitely have to intensify our programs in place to try to stem the epidemic of overweight and obesity in our community, which is increasing at an alarming rate. I thank you.
Thank you, Professor St. John. That was an excellent presentation. And one of my big takeaways from that was the need for data. We need to start tracking the dietary patterns of our citizens as well as our children so that we have the evidence to guide policy and programming. So I wanted to remind everyone to use the question and answer feature. Please type your questions there. I've seen a few hands raised. Please use the question and answer feature and we will respond to those questions. Next, I would like to introduce Dr. Tanya Bobrin. She is a family physician. So we're now shifting from the pediatric population to the adult population. Dr. Tanya Bobrin specializes in functional and integrative medicine, as well as she is a certified wellness and lifestyle empowerment coach, motivational speaker, and author. Dr. Bobrin is speaking on COVID-19 and diabetes, emerging trends and implications. Dr. Bobrin, the floor is yours.
Can you hear me?
Yes, I can.
Yes.
Go ahead.
Thank you. I just want to commend the HCC for putting this on, because I think now is the time that we have to make the decisions and act, not only for ourselves, but for the children and the rest of the community. Next slide, please. So I had to plug this in. You know, everybody, I'm from St. Lucia, and we have this simply beautiful island. And then there was COVID. It's still beautiful, but we have lost access to many of these beautiful spots for various reasons. Next slide. The Caribbean has the highest rate of mortality in the Americas from NCDs, with more than 40% of NCD deaths occurring prematurely in people under 70 years. In 2014, the leading causes of death from chronic non-communicable diseases included heart disease, stroke, diabetes, and hypertension. And I think we need to look at how has COVID-19 affected this. Next slide, please. As a functional medicine and integrative medicine practitioner, I've started looking at disease in a slightly different way, still focusing on everything I've learned over the past 20-something years. And the major contributors to disease would be inflammation, stress, and we have to always remember insulin resistance and its context with metabolic syndrome, which is really rampant in our community. And I don't think enough of us physicians are focusing on how insulin resistance impacts our patients and their health and lives. Next slide. So I want to talk about chronic stress because I think that every single one of us, everybody here on this, all the panelists, everybody listening, have been impacted by COVID-19, and everybody has had some element of stress. And the effects of stress on the body include increased insulin secretion, increased deposition of fat in the body, altered immune function, which is so vital as we talk about COVID. You have muscle wasting, you have thyroid dysfunction, bone loss, degeneration of brain cells, and neuroinflammation, which is something we have to focus on, especially with the emotional impact that COVID-19 and the subsequent lockdown has had on our population. We have memory loss, altered sex hormones. Of course, we're seeing anxiety, emotional instability, and depression, an increase in cardiovascular disease, and importantly, receptor site activation on tumor cells. These are all impacts, scientifically documented impacts of chronic stress on our bodies. Next slide. So what then? How do we combat what's going on? You know, we've all heard about the COVID-15. Many of my patients are actually coming with COVID-20 and 25. And that's the weight gain of 20 and 25 pounds over the past 3 to 4 months. So what do? We aim to maintain normal weight and avoid overweight or obesity, with the abdominal circumference being less than half our height in inches. We aim for physical activity for at least 30 minutes or more with moderate intensity, and that's daily. And that would be great for our mental health as well. For those with no history of substance abuse, we could advise consuming 1 alcoholic beverage before or with an evening meal. But the latest studies are saying that, especially in women, we would advocate absolutely no alcohol because of the impact of the alcohol on the health of our women. We need to prioritize sleep and stress management with healthy coping mechanisms, meditation, prayer, time in nature, and really connecting with our loved ones. Next slide, please. So the simplest way to go about it is to eat clean. No white sugar, white flour, no processed foods, no chemically enhanced foods, and no artificial ingredients. It's the simplest way if we look at it. And how do we do that is simply eat food. And that's food with one ingredient. The photo on the right is actually my box of greens and vegetables that my box was delivered during the lockdown. We had a vegetable delivery service. So that's an actual photo of me with my vegetables, and I would get that every week. Next slide, please. But this is our typical Caribbean meal. You see the carbs, you see the protein, and a smidgen of vegetables or greens in each one. But this is what we are used to eating. This is what you buy on the side of the road from restaurants. Most people are having that for lunch and or dinner. Next slide. I want to put a special mention to those parents who are working from home and homeschooling their children. The impact on the health of these patients, the emotional health on the parents as well as the children, the impact of the chronic eye strain because we are glued to those screens. The children are using it for school, the parents are using it. To those parents who have had to balance Zoom meetings for work as well as Zoom schools, I really do send out a special message to you to hang in there because I know it can't be easy. Next slide, please. So how do we survive and thrive beyond COVID? Because there is, we know, the socioeconomic impact on the Caribbean. It has impacted the health of our people as well as our healthcare systems. Employment has been affected with significant job loss. Our educational systems have been impacted. Some of our children no longer know when they're going to school. Our travel and tourism industry, which we rely so heavily on, has been practically reduced to zero. Hopefully it's coming back up now. Our agricultural industry, our culture, many of us have seen carnivals postponed or outright cancelled. In St. Lucia, we have a cultural festival in October that has recently been cancelled. The impact on the environment as well, hopefully in a more positive way. Social relations, some people have not had the connections that they would ordinarily have had. Those are people who are working from home have seen that they're not able to connect as well over Zoom as they would do in the, over the workplace, in the canteens, and, over the water coolers in the offices and so. And of course, the stress. Next slide. So I want to just talk a little about Project Ice Storm, which happened in January 1998 in Quebec, and there was a power cut. And this study was designed to study the effects of in utero exposure to varying levels of maternal stress, resulting from an independent stressor on the development of the child from birth through childhood. And prenatal stress was shown to epigenetically program the physiology and behavior of the offspring and may become a risk factor for adult complex diseases. And we know from that chronic sustained stress will affect future generations. So my question to you, and I just want to put it in your head, is what is the impact of COVID-19 related stress on NCDs, on our brain and mental health, and on the genetic predisposition of the next generation to those NCDs? This is just something I wanted to put forth because I think we're focusing on all the other clinical aspects of what's happening with our patients. There's obesity, there's increased, my pre-diabetics some of them have converted to outright diabetes. And some patients who were normal last year when they came in for their regular physical, they were actually pre-diabetic. They had increased the percentage of visceral fat because I checked that. Their waist circumference had certainly increased. Their weight had increased. And some people who were going through stress had increased blood pressures, and also the fasting insulin levels had increased. And that was in comparison with what we had seen last year. So as I said, this is, as Dr. St. John said, this is anecdotal. We have this, we don't have an official study, but we are aware that if we don't take action now, we will have a significant increase in those diseases, and our healthcare systems in the Caribbean, I don't think, is equipped to handle what may happen. Next slide. So thank you. If you want to reach me or thing, you can find me at tanyabobran.com, or you can email me if you need any further information, tanya@tanyabobran.com. Thank you.
Thank you, Dr. Bobran. That was an excellent, excellent presentation. really made us think about the stress and the mental health and the anxiety that people are under and the impact that that has both in the short, the medium, and the longer term. I would like to introduce our next panelist. Her name is Dr. Siobhan Bell. She is a consultant pediatrician and head of the pediatric department at the Mount St. John's Medical Center in Antigua. Dr. Bell Jarvis is speaking on emerging trends in pediatric BMI in Antigua and Barbuda over the course of the pandemic. Please go ahead, Dr. Bell Jarvis.
Good morning, everyone, and thank you so much for having me. I've dubbed this morning's presentation as Weighed in the Balance and Found Wanting. So I hope that we're engaged in this morning's presentation. You can proceed. So the objectives really are to review the factors contributing to the pandemic and weight gain in children, to review the trends in BMI among children prior to the pandemic in Antigua and Barbuda, to highlight the likelihood of BMI trends as the pandemic progresses, and to review strategies to maintain or reduce childhood BMI at an institutional level within healthcare systems. Next slide. So this is a very important graphic here. It basically reveals the close interaction of COVID-19 and obesity. So because of COVID-19, we've had societal interventions, which ultimately result in lockdowns, physical distancing, and self-isolation. These in turn result in increased socioeconomic hardship, deteriorating psychosocial health, which ultimately lead to chronic stress, altered eating behavior, and there's a change in the energy homeostasis with worsened obesity. Now with obesity, we recognize that we can have worsening of COVID-19 because we know our ACE2 enzyme, the angiotensin converting enzyme 2 enzyme, a transmembrane enzyme that facilitates the entrance of the SARS-CoV-2. And with this, we know that persons, or we suspect that persons who are obese have an increase in this enzyme, likely therefore having a worsened outcome with COVID-19. We also know that patients who have obesity, it has been postulated that there is an altered immune response, which puts them at increased risk of a cytokine storm. And we also know that lung capacity can be negatively impacted because of obesity. So roughly we can say we have two pandemics which basically can aggravate or exacerbate each other. Next slide. And so what has been the outcry in the local context? So these experiences would have been shared through clinical interaction. And of course, these are more so obvious through, anecdotal inferences as opposed to collected data. So we know that there's socioeconomic hardship, and this outcry is not only in the local context, but internationally. We have loss of jobs, reduced hours, lack of remuneration, and delayed salaries. This, of course, is going to impact the ability to basically purchase the food that is appropriate and thought to be healthy. We have psychosocial insecurity, which was spoken of earlier, anxiety, depression, adolescents, body image issues, and this, of course, is going to lead to emotional eating. We have altered food behavior. So many of us would have been caught up in the panic buying. And of course, because we want the items to last very long, we're going to go towards those foods that are processed and, will be preserved. And so with the panic buying, of course, our input has changed because we're home, we altered food cues, and there's food hoarding. With limited physical activity, because of the physical restriction, we recognize that basically our children will continually put on weight because again, we have increase in terms of energy consumption, but decrease in energy utilization. And again, this is because of closed facilities, we have closed schools, we have online learning, which unfortunately for many do not include a physical activity feature. With physical activity limitations as well, or even physical distancing, we recognize that in many occasions, the older child is asked to watch the younger child, and in preparing meals by extension, they tend to go towards meals that are easily prepared. So again, our processed foods. Next slide. So what does history paint for us? What picture does history paint? I look back at an unpublished study by Dr. L. Walwyn and S. Hunt, where they looked at the habits within 8 primary schools, 5 secondary schools, a total of 4,029 students between the ages of 5 to 20 years. This study took place between 2006 to 2009 in Antigua, and they primarily looked at age, sex, weight, blood pressure, body mass index, and the presence of acanthosis nigricans. And the rationale for this study was that, as we know, non-communicable diseases are the leading cause of morbidity, mortality, across the world, and in Antigua and Barbuda, by no means of sparing. There's no protocol for routine screening or annual examination. And on previous review, we recognized that we had a 150% increase in obesity between our 0 to 5-year-olds in Antigua and Barbuda. Next slide. And looking at the data, we recognize that in terms of either being obese or overweight, as you got older, the likelihood increased. And our patients who are greater than 18 years actually led the way, and we're actually at 35.7%. Next slide. When we broke it down based on being overweight, percentage being overweight based on age and sex, and even looking at gender as well, we recognize that our females led the way. And again, the trend was pretty similar. As you got older, you were more likely to be overweight or obese. And we recognize that once you're older than 18 years old, you had a significant concern. Next slide. So this graphic or graph here basically shows a study that reviewed an early childhood scenario in the United States where kindergarten children in the year 2011, they were basically taken in as a cohort. And what is done here, based on what you're seeing, is what is called modeling. So basically, they were looking at the prevalence of obesity amongst the kindergartners, and they had just about 15,631 participants. And they basically wanted to project what the trends of obesity would be like heading up to March 2021. We recognize that the control would have been outside of the time of COVID. Scenario one would have primarily been the 2 months of closure, April to May 2020, during the times of COVID. Scenario two would basically have extended to include the summer, where they projected that they would have had a 10% decrease in physical activity. And then you had scenario three, where basically they're looking at continued closure up to October, and scenario four, where we have complete closure extending down to the end of this year, December 2020. And what they found is that in terms of the prevalence of obesity, 13.5% of the children looking at the control would have started out as being obese April 2020. And by the time we reached to March 2021, we recognize that they would have moved up to at least 14.7%. And what we see in this graphic here is that you have a continual increase in trend of the prevalence of obesity as the duration of school closure extends. And this was attributed primarily to a decrease in physical activity, but we do know that there are other contributing factors to include the eating pattern. Next slide, or proceed. So with that, we recognize, looking at the Healthy Caribbean Coalition, looking at Antigua and Barbuda, we recognize that in our setting in 2010, we actually had insufficient activity, because looking at ages 11 to 17, 78.3% of both sexes actually had insufficient activity in schools. When we looked at having activity more than 3 days per week during the school year, for both sexes, only 26.4%. And when we looked at those who spent 3 or more hours per day doing sitting activities, we recognize that we're at 54.8%. So if this was happening in the pre-COVID era, we can only imagine what is happening now. Proceed. And so going back to Dr. Waldwin and S. Hunt in 2012, the overall prevalence of being overweight or obese was 26.5%, with the less than 10-year-old being at 20.7%, and being greater than or equal to 10 years being at 28.5%. So again, if we were to put ourselves within the model, although we're in a different jurisdiction, we can imagine that our numbers are going to increase significantly. Next slide. And so this is an institutional framework which is very important. So we would have had previous reference as to what patients can do when it comes to the management of obesity, but let's look at what institutions can do. We have to look at the process. We have to look at output. We have to look at outcome. The national strategic leadership on diet and physical activity cannot be limited to the Ministry of Health. It must integrate those in education, transportation, agriculture, those that deal with trade and policies, those that deal with communication, those that deal with the management of urban settings. When we look at outputs, we have to look at having a supportive environment, supportive policies, and those who are in charge of policies must ensure that it does not increase the gap or tip the scales any further, leading to further inequality. We have to make sure that there's behavior change. So when we have public health issues, we look at upstream management, midstream management, and downstream management. So upstream management is going to speak to what is going to be done from a policy level, midstream is going to speak to behavior change, and then outcomes are going to speak to what we do in terms of clinical interventions. And as has been stressed previously, we have to monitor, evaluate, and do our surveillance. Next slide. And so just to highlight pretty quickly, as our time is basically gone, here in Antigua and Barbuda up to a 2019 review, we really have some work to do because currently we are able to look at the childhood obesity prevention, having an active forum there. We have subsidies in terms of local fruits and vegetables, but there are other areas of priority. Next slide. And so our areas of priority locally must include nutrition literacy, early childhood nutrition, marketing, trade and fiscal policy, school and community interventions, resource mobilization, and strategic planning. Next slide. And so there will be potential barriers as displayed. Culture is a significant one. We know we have to be innovative in times of COVID. Human factors have plagued the Caribbean. We have a limited resource pool, and we have to recognize that we have to monitor our data. Last slide. And so recommendations going forward. We have to have buy-in from the top down, bottom up. We must have a multi-sectoral approach. We have to institute policies. There's no way that we can move forward unless we're monitoring and evaluating what is happening, and we have to be innovative. Thank you so much for having me. These are my references, and I hope that we can tip the scales in the opposite direction when it comes to the management of childhood obesity in the face of COVID. Thank you.
Thank you, Dr. Bell-Jarvis. Another excellent presentation. And so all of these presentations lead us quite nicely into our final presentation on key policies and interventions to tackle childhood obesity, delivered by our final speaker, Dr. Elisa Prieto. Elisa is the NCD and Mental Health Advisor at the Caribbean Sub-Regional Program Coordination Office of PAHO. Dr. Prieto, please go ahead.
Thank you, Maisha. Good morning, colleagues, and thanks to the HCC for inviting PAHO to this very important dialogue. And as Maisha mentioned, I'm going to be touching on key prevention policies and some of PAHO's technical cooperation. And just to preserve internet bandwidth, I'm going to stop the video while I present. So next slide. I'd like to start framing this discussion around a very important key message. Childhood obesity is a rights of the children's issue. We know childhood obesity, and we've heard this from previous presenters. We know it effectively undermines the physical, social, and psychological well-being of children, and is a known risk factor for adult obesity and NCDs, adding to the social, economic, and development costs of this pandemic. So there really is an urgent need to act now to improve the health of this generation and the next. And this urgency has been repeatedly acknowledged by our leaders, as you can see in the next slide, which shows, next slide please, shows just a selection of different global, regional, and sub-regional commitments and accountability frameworks that our member states have endorsed to address NCDs, overweight, and obesity, including a series of targets to monitor progress. And this sense of urgency, as we've heard from the previous panelists, is even greater in the current context of COVID-19 and renewed discussions around food and nutrition security. Next slide. And I'd like to highlight that these commitments and accountability frameworks really offer a very clear roadmap with evidence-based, cost-effective policy options to address overweight and obesity. And I would like to draw your attention to the 4 policy options on the slide, which have proven to have the greatest health outcome impact at population level. Next slide. And I'm going to comment very briefly on some of them. So starting with taxation, adequately structured excise taxes have the ability to raise the relative price of SSPs compared to other products and services, and have the potential to reduce their affordability and therefore their consumption. And this can create a win-win-win-win situation, that is 4 wins, of reduced consumption, improved health outcomes, reduced associated healthcare and social costs, and increased revenues from the tax that contributes to financial development. And this is particularly relevant in the current COVID-19 context, where excise taxation on tobacco, alcohol, and sugar drinks have the potential not just to prevent NCDs, but also to provide an additional immediate and much needed source of revenue to fund the COVID-19 response, economic recovery plans, and efforts towards universal health. And some countries in the Americas are really looking at these health taxes as an option in the current context. We've also heard about marketing, and we know advertising, promotion, and sponsorship are extensively used to market food to children around the world and in our region. And evidence shows that the products most commonly marketed to children are high in fats, free sugars, and salts. And children are particularly vulnerable to marketing, as they're not able to discern the persuasive intent of these marketing and advertising practices. And again, this places the issue of protecting the rights of children at the very front and center of our discussion on the need to regulate. Improving settings, and we've heard the experience in Barbados to enhance the healthy school environment. And some of the policy options include school nutrition standards to guide adequate food programs, restrictions on the availability of foods and beverages with unhealthy profiles, prohibition of advertising, promotion, and sponsorship, and regulating food availability in your schools, among others. So next slide. I would like to stop just a little bit on the policy that you had at the center of the previous slide, front of package labeling. So why front of package labeling? The rationale for front of pack lies in the way we make purchasing decisions. So there's very strong evidence showing that consumers spend very little time and cognitive effort when it comes to repetitive decisions, such as the ones we make on a typical shopping trip. And it is well known that the information provided to consumers needs to be easy and quick. And nutrition facts panels don't really meet these requirements. What you have on the slide, which is impossible to read, really shows the different steps that will need to be taken to adequately interpret a nutrition facts panels. Consumers would need to have high nutritional literacy and employ significant time to be able to use these nutrition facts to inform the decision making. Next slide. And it is for this reason that front of pack really plays a critical role. And there are many different systems, and when we look at them, it's important to bear in mind what is the public health objective of this policy, which is really to help the consumer identify in a quick and easy way products that are high in the critical nutrients that are associated with overweight, obesity, and NCDs, free sugars, fats, salt, sodium. And for this purpose, the high-in approach, which is what you have to the right of the slide, those black icons, has consistently proved to perform best as compared to the other systems in terms of attention capturing, information processing, understanding and usage, and change in purchasing decision. And I'd like to highlight that CARICOM and its leading agency, CrossQ, are currently revising the existing prepackaged food standards to integrate front of pack specifications using this high-in approach, which would most definitely represent a huge step forward in the right direction for the Caribbean if approved and implemented. Next slide. And I'd like to very briefly share the Chilean experience to show how these pieces can come together in a comprehensive regulatory approach. So the Chilean Food Act includes 4 pillars, and at the core is the mandatory front of pack high-in system that I just mentioned, which is used as the basis to restrict advertising of high-in products to children under 14 and ban the sale and promotion of high-in products in schools. This Food Act also includes an education, nutrition, and promotion of physical activity in schools, please. And this type of comprehensive regulatory approach can really go a long way. A recent study in Chile has shown a decrease in household volume of high sweetened beverages purchases of almost 24% after implementation of the policy package, which is a very significant reduction. Next slide. And before I close this really quick overview of policy options, I want to touch on breastfeeding and promotion of breastfeeding, and just mention the Baby-Friendly Hospital Initiative and the International Code of Marketing of Breast Milk Substitutes that you have on the slide. And I'd like to somehow hint a positive note in the current COVID-19 context, where we are hearing anecdotal evidence through breastfeeding groups of increased interest on breastfeeding for many different reasons: more time at home, more opportunities to bond with baby, economic factors, a desire to enhance the baby's immunity. So this is a very relevant topic, and I think an opportunity that we need to pay attention to. Next slide. And just real quick, some highlights of PAHO's technical cooperation. PAHO continues to provide technical guidance, tools, and resources in support of our member states and sub-regional partners. And I'd like to highlight the PAHO nutrient profile model that you have on the slide, which is a key tool to facilitate policy implementation and identify products that are high in those critical nutrients we've been mentioning. PAHO is also pushing and promoting South-South cooperation and the much needed multi-sectoral, multi-stakeholder approach to tackling this problem, which we've heard in the other presentations, and it's one of the big challenges, right? So we have been strengthening capacity for the use of law to address NCDs. This is a key piece. All the different policies that I've mentioned require the effective use of laws and regulations. We've been supporting the front of pack development process through a cooperation between Chile and CARICOM. And of course, we work very closely with civil society and with the Healthy Caribbean Coalition on different areas of work. And I'd like to highlight conflict of interest as a key piece of this problem and this work. We are also collaborating with CARFA on food and nutrition surveillance and supporting advocacy and communications efforts. And I'd like to share with you, you have it on the right of the slide, this social marketing for public health course that was very recently launched. You can find it in our PAHO Virtual Campus for Public Health webpage. And it's a 5-course program looking at enhancing capacity for social marketing. Next slide. And just to close, I would like to share with you this statement by the UN Special Rapporteur on the right to health, on the adoption of front of pack, and going back to this idea of this is really a rights issue, and it's beyond a rights of the children issue, it's a right to health issue. So I'll just read for you the first paragraph, and I'd like to encourage you to check out the whole statement. So non-communicable diseases are a major challenge of this century, highly rooted on overweight, obesity, and unhealthy diets. As part of their right to health duties, states should address the diet-related NCDs preventable risk factors and promote frameworks whereby the food and beverage industry convey accurate, easily understandable, transparent, and comprehensible information on the products. Front of package warning labeling regulations are much needed in this regard. So with this, I'll close. Thanks very much for your attention and look forward to the discussion.
Thanks very much, Dr. Prieto. Excellent presentation. Really highlighted us the fact that we have these evidence-based policies, which we know work, which have been endorsed at the highest political levels. And we know these policies can dramatically shift our food environment in support of healthy, nutritious food access for all people, children and adults. Let's shift now to the question and answer. I'm conscious that we have many questions. So I'd like to kick off with my own question, which relates to the ultra-processed food and beverage industry and the obesity epidemic prior to and during COVID. Now, the HCC tracks many of the regional food and beverage industry actors on a regular basis. We've observed a surge in pervasive online marketing and acts of corporate social philanthropy during the COVID crisis. Since March 2020, we noted 47 instances of donations of products, most high in salt, sugar, and fat, and these were directed towards vulnerable people, including those living with NCDs and children. There were almost 20 instances of donations of fast food, mostly to children and healthcare workers. In some instances, these foods paired with branded paraphernalia were provided to the most vulnerable, including children in children's homes. And we've also seen recent headlines across the region boasting of increased profits for this sector in particular over the course of the pandemic. So I'd like to ask the panelists, what are your thoughts on the ultra-processed food industry and the role they have played in the global and regional obesity epidemic and the potential role they've played in exacerbating overweight and obesity over the course of this coronavirus pandemic? And I'd like to direct this first to Dr. Soares, and then any other panelist can jump in if they'd like.
Hi, good morning again, Maisha. Yes, unfortunately, as you said, what we've been seeing is an increase in marketing, and not just marketing in terms of ads, but also deliveries. We have a lot of home deliveries, and because persons are at home now, then it's not about them going to the food will actually come to them. And so what it has done is increase the convenience of accessing those foods. We also see an infiltration in our school feeding programs, for instance. And while a lot of these may come across as being very charitable donations and filling that stopgap, it really is impacting on our most vulnerable groups. It brings about a desire and preference for unhealthy foods, which over the long term, as we know, can lead to more obesity. Another key thing is that it also brings brand buying from very early ages, because if children get accustomed to certain brands and unhealthy foods, then what it means is that when they become adults, that brand loyalty goes with them. And so it brings that reliance on ultra-processed, unhealthy foods, and it can create issues of what we call hidden hunger later on, and it will just serve to increase our food insecurity from a national level. So that's why these policies are very important.
Thanks, Dr. Soares. Does anyone else would like to comment on what they've seen and perhaps solutions? Dr. Prieto?
Sure, I was trying to unmute myself. Thanks, Maisha. No, just to reiterate what Suzanne was saying, this situation is only exacerbating the obesogenic environment that we know has been driving the obesity epidemic. And I think the key policies that I just highlighted are super relevant. And that's something that I didn't show in the presentation, but we are lagging behind in the Caribbean when it comes to implementation of these policies. You know what, I think you kind of hinted, and Susanne as well, to the need to regulate donations, right? And in that regard, PAHO is working with member states and with our emergencies team to try and provide guidance that ensures that we bring on board some of the recommendations that I've mentioned, such as, for example, the PAHO nutrient profile model or WHO PAHO recommendations to manage conflict of interest and undue influence of processed and ultra-processed foods companies. So definitely, I think the current situation is only fueling an already existing problem, and it brings up the need to accelerate implementation of the policies that we have been discussing. So yeah, over to you.
Thanks, Dr. Prieto. Any of the other panelists would like to comment on this particular issue around the ultra-processed food and beverage sector? Dr. Beaubrun.
I want to play devil's advocate just a little bit here. For those parents who are working from home and homeschooling their children, I have heard that it was just easier to take the kids for a drive-through. It was easier to have packaged food and just unpack it and feed them. And those of us who have been there will understand. So while we are trying to balance eating clean and eating healthy, we also have to put in other systems to support those parents who are just stressed to the max, who are going through God knows what. They're worried about their job, so they can't afford to take time off the Zoom meetings to prepare a meal for their children. And the children are going crazy because the rug has been pulled from them. And we all know that nothing is as good to satisfying our stress as the combination of fat and sugar.
Yeah, and you've highlighted the reason why the problem has escalated.
Yes,
it's why we do need solutions.
We're comfort eating, and it's convenient, and so we need to make healthy food easily accessible, affordable, and maybe have some drive-through vegetable and smoothie stands.
Great, thank you. Okay, we have some questions from participants that I'm going to go to. Dr. Marcia Munnings, she's the head of the Healthy Bahamas Coalition Secretariat, and she sent ahead some questions. And her first question is, what are the short and long-term impacts of COVID-19 on our food systems. And I think we've discussed quite a bit of that. So I'm going to go to her second question. What about obesity and disease? Given what we know about obesity and disease, what is the advice to stay healthy in an unhealthy world? And I think Dr. Bobran, you've just touched on that. Does anyone else have any feedback on that question? Some specific tangible advice, practical advice that we can move forward with.
I'll go here. You know, it's such a challenge because even before the pandemic, the taste, and I speak particularly to children, but it can be by extension, has basically been tailored to a particular type of food. When we look at the life stage approach of obesity, even preconceptionally, we have increased BMIs, we have increased weight gains during pregnancy, and the evidence is now suggesting that the taste that is acquired by the mother in pregnancy will also affect the child moving forward. So when we look at the approach now, we have to look at what can be done now to affect the future in the long term and what short-term effects we can have. I think for the short term, especially as it relates to children, we can try to integrate a bit more of healthy eating and healthy snacks within our online school programs. And I said before, I like what's happening in Barbados in terms of having, you know, an online physical activity program. But in terms of foods, definitely smoothies, definitely trying to make the food more, you know, attractive, trying to let the children participate or actively help in preparing the food is really a good way to go. And in the long term, educating our patients, empowering them so that they can recognize the need for themselves to eat healthily.
I'd like to pick up on one of the things you just said, and is having children participate in preparing food. Like, how do we also take advantage of the fact that many of us have to be home with our children, and that has a whole side to it, in which we're all very much aware of stress, of having to homeschool, of lacking other authority figures. It's so distressful, but at the same time, it provides an opportunity for us to have meals together, to prepare meals together. So how can we garner that? How can we, I'm going to be sharing my personal experience here, but I have managed to do two really good things. I've managed to exercise consistently, which I wasn't before. And I have found all these local producers in Barbados that I didn't know before the lockdown. So I've suddenly discovered this whole network of locally produced, you know, healthy foods that I just didn't know that existed before. So how can we use some of these challenges to find the opportunities? And I really liked your point about eating together, preparing food together, enjoying food together.
Great. I have a question for...
Can I just come in quickly before? One of the things that has worked for us, everybody loves challenges. And so we've tried to, even through education, stimulate challenges amongst the children. Okay, let's see who can eat most healthy today. You know, let's see who can say, okay, I've had, you know, 5 servings, fruits and vegetables, and then we sort of, you know, give a prize. So giving positive rewards for positive activity has really been helpful. And again, having that private-public partnership where we engage our communication stakeholders. So even for us on our station, every Friday, there's like a homeschool 101, and they do so many things. They have running, you know, different exercise activities, and even ways that they can prepare something very simple, you know, something very creative using the colors. So challenges works well with children, and rewarding them likewise for winning these challenges will help us to move to a healthy start.
Thanks. Okay, I have a question for Zanuck. One of the participants would like to know how did you modify your insulin dosage regimen when you changed your diet? You reduced your carbohydrates. Tell us a little bit more about the adjustments that you had to make.
Okay, so this response is a bit complicated, so I hope I can explain it good enough for you to understand. So normally I would take 12 units of insulin with each big meal, and that's like a full meal with a glass of juice and so on. If I'm eating less carbohydrates, like let's say I'm simply having a salad with meat instead of a high carb meal and water or unsweetened tea, I would definitely have to reduce my insulin intake. I would not be able to take 12 units anymore because I would get, my sugar would drop way too low. So what I then have to do is test my sugar based on the reading. Let's say my reading is 200. I then subtract from that what I would like my reading to be. So let's say 100. The ideal reading is 100. So I subtract that from the 200, and then I divide that by 20, and I would get 5. So then I would take 5 units of insulin to bring me down to that 100.
Okay.
Yes.
Okay, so then I think the main message here is that you've had to make modifications and you're working on it. It's an ongoing challenge.
Yes. So based on what I eat, that's the amount of insulin I would take. I would not be able to keep it's not a clear cut, so I cannot keep taking 12 units for everything I eat. If I eat less, I have to take a little less and maybe reduce by 2 units. I would not take a big jump. So I would not go from 12 to like 4. Maybe 12 to 10 or 12 to 8, that kind of thing. Gradual. And when you're making that kind of adjustment, you have to test maybe 2 hours later to see where you're at, to see if it worked. The entire thing is a trial and error experimentation phase.
Okay, thank you, Zanuck.
Yeah.
So we're going to a question from Michael Ozuomba. Was it possible that proper planning would have allowed for adequate care of patients with NCDs at the district and regional healthcare centers during the lockdown? Would anyone like to take that question? How would planning have allowed us to be better prepared to manage those living with NCDs during lockdown periods?
This is a difficult question, Maisha, because no amount of training ever prepared us for this. I think we're winging it. We're learning as we go. But I think the lesson here is that lifestyle is key to everything that we're talking about. And it's about nurturing our bodies, nurturing our minds, nurturing our spirit, all in an attempt to just survive this time and be able to thrive after. So I don't think anybody can really answer this clearly, because we don't know. We were never trained for this.
Thanks, Dr. Bobra. And the next question is for Dr. Prieto from Beverly Barnett. The 2018 Time to Deliver report from the WHO High-Level Commission on NCDs recommended that WHO rationalize the numerous global indicators for progress in NCDs. One of your slides demonstrated this complexity. Is any work being done to address the High-Level Commission's recommendations?
Sure, that's a very good point, a very good question. We have a number of accountability frameworks and demands, and I think there's an ongoing effort to rationalize that, to reduce the burden on the countries also in terms of reporting, and to improve accountability, right? So I think in the Caribbean, one of the initiatives that is contributing to this, the work around Caribbean Cooperation in Health and the integrated surveillance system that CARFA is looking at establishing to be able to report on indicators. But definitely it's an ongoing effort to really get to that point of being efficient and streamlining reporting and making sure that the indicators are strategic and provide the information that can guide decision making and can really push for accountability. And I think in the chat there's another, I don't know, Maisha, if you were going to get to it, another very interesting question about how to materialize accountability. How do we move from those frameworks, those commitments into real action? And so the chat, the comment very well says, probably this takes all of us, right? And that's one of the points that I was trying to bring across with the last slide of my presentation. How do we garner a social movement? How do we empower people to really feel that this is their right to food, the right to health, the right of children to thrive, to be healthy? How do we create that need and that demand, right? So, and part of that has to do with accountability.
Yes.
So,
excellent. Thanks, Dr. Prieto. We have another question for Professor St. John, shifting slightly. They would like to know if there are regional standards for telemedicine, because you mentioned that as one of the strategies moving forward. Are there regional standards for telemedicine and patient evaluation in the Caribbean? Professor St. John.
As far as I'm aware, not. Telemedicine is a relatively new concept and has escalated to huge proportions since the COVID pandemic. But with the increased use of social media and various mechanisms, even the telephone, you don't have to look at the person to be able to assess them. I am not aware if there's any legislation or any regulations in part. I would guess not, since we're so far behind in many other aspects of health, that sort of thing. I would hazard a guess not.
Okay, thank you, Professor St. John. Another question is, what are some of the virtual healthy lifestyle programs you'd recommend for children? And this is for any of the pediatricians, Dr. Bell Jarvis.
So for me, I love to put things into a local context. So although there are many things that, may be available, I'm not familiar with anything that is formally arranged per se. I think that we locally can create something that is contextual to us within the Caribbean, within each country, to address the needs of our children. So as I said, I think we need to be creative from the school platform in terms of having a program. I saw a comment by one of our attendees saying that they actually in Jamaica would have integrated a physical activity component with healthy eating through their online programs, through integrating with the TV station. And so I think it's something from a local context that we'll have to strive to do, but I'm not aware locally or regionally of something formally that, that is available.
Okay, thank you. Another good question here from Patricia Thompson. She's asking, how can we better utilize dietitians, nutritionists, practitioners on the ground working with populations one-on-one? Are there examples of best or emerging good practices in this area? And this is open to any of the panelists.
Hi, Maisha. I'll take that. So currently, I think most clinics, especially in Jamaica, we do have nutrition professionals at the clinic level, and several nutritionists and dietitians do practice in private settings and in most hospitals. What would be good is for our nutrition societies across the Caribbean. So here we're Japinat in Jamaica and Candy, which is a regional institution, to more engage in the process of our policy development activities that are taking place, understanding that quite a lot of the details are very food specific, and so they can make a great impact there. Also in engaging even work sites, most work sites do have health promotion initiatives that could benefit from having a nutrition professional involved to ensure that the guidance that is given around healthy eating and even healthy lifestyle will be of benefit.
Great, thank you. We have a question from Dr. Asen Usberg from Facebook. Dr. St. John, can you provide some insight into the data recording and reporting? Who records the data and how to and who is the data reported on and who analyzes the data? Can you speak on the collaboration between the education and health sector?
I am not clear from this question what data the doctor is speaking about. Is it data which is gathered from our youth gym, or is it national data on childhood obesity and overweight? I'm not sure, so it's difficult to answer the question. If it's related to our youth gym, the data is recorded at the Heart and Stroke Foundation. It's kept confidential, and it's analyzed within the foundation by me and an analyst, and we're planning to shortly reveal some of our data which we've collected over 4 years of the experience of a intervention program in a cohort of students who were overweight or obese attending the Jem.
Thanks, Professor St. John. We have a question. I think perhaps this can go to Dr. Prieto, and that's, does anyone know the status of the FOPL in CARICOM? This is coming from Lucy Hinton.
Sure. So CARICOM, it's the Caribbean Regional Standard Organization, organization, leads the process of revising the existing standard on prepackaged foods to add front of package labeling specifications. And this has been an ongoing process over the past 2+ years, and it involves extensive consultation through member states, through the National Bureau of Standards. And the National Bureau of Standards work with different stakeholders that have for which the standard is relevant to provide input to the process. So right now, CROSS-Q is finalizing the draft that would go to voting. But the exact status is something that, it's really CROSS-Q's process, and they are best positioned to provide an exact update. I can only say that the standard is close to being in that final draft status, and hopefully that would mean it would go to voting and we would be able to have a really powerful tool in the Caribbean. Not sure if that answers the question.
That's great. So we're nearing the end of the webinar. We've got about 2 minutes left. I'm going to ask each panelist to very briefly, 20-30 seconds, just summarize a key message, a key takeaway that you'd like the audience to move away from this webinar with. And let's start with Dr. Beaubrun.
Thank you, Maisha. I think my key takeaway for us, as I would do with every patient, is lifestyle. It's about nurturing our bodies with clean food, exercise, adequate water, nurturing our minds by focusing on sleep and healthy coping mechanisms for stress. I know we spoke about the alcohol, the bottles of wine that have been drinking, and the effect that we saw in our patients when they had no access to alcohol was astounding. The lines of that weaved round the block when the alcohol stores reopened was very telling. And nurturing our spirit, the connections to our families, our friends, our loved ones. We may be far apart, but we can still use things like Zoom to connect. And also connecting with something greater than ourselves, and also connecting with who we are and what our purpose is, so that we can truly use this great pause of 2020 and come out of it, because we will come out of it. The pandemic will end. We just don't know when. So let's hope that we can come out of this healthier, happier, smarter, wiser group of individuals, and that our climate improves as well, so that we can continue living healthily.
And Dr. Bell Jarvis.
We really have to empower our patients. The drive must come from within, but in order for our patients to make the right choices, they have to make informed choices through our education. Our patients also have to be protected through the policies that exist and the framework of our institutions. There must be accountability, transparency, and monitoring through our policymakers, stemming right down to our clinical centers. And lastly, we have to have a life stage approach. It has to start from our preconceptional days, coming right up, because children who are obese more than likely become adults who are obese. So let's try to make the change from early days so that we can tip the scale in favor of less obesity and less overweight.
Thank you. And Zanek.
Sure. For me, a major thing is education. And in speaking with people, they will tell you that healthy eating is expensive. It is cheaper to get a packet of biscuits for 50 cents than it is to buy a piece of watermelon for $5. But you need to think of the bigger picture, not right now. If you're thinking of right now, the biscuits is cheaper. But if you're thinking of the long run and your overall health and the doctor bills that will come in the future, I think it's better for us to educate ourselves to make wiser decisions. For example, nutrition facts. Do we understand what it means when we see something consumed, something entails 56 grams of sugar? what is that equivalent to? That may be about 14 teaspoons of sugar. Could you actually imagine yourself sweetening a glass of juice with 14 teaspoons of sugar? But people will think that's crazy. And they will say, no, I would never do that. But we actually do that when we consume a soda or sugary drink. So a major part of it is education. And this year, Rotary 70-30, District 70-30, the entire focus is on childhood obesity with the youth. So we'll be working with schools and focusing on them eating healthier, drinking more water, and engaging in physical activity. It would be a bit difficult considering our COVID-19 protocols that have to take in place. So instead of engaging them in the classroom, we will try to engage them at home and challenge them, as the doctor said prior to me.
Thank you, Zanuck. Yeah. And Dr. Prieto.
Sure. So my key message is we really need to facilitate those lifestyle changes with the environment, shaping the environment, advancing implementation of the policies that make that watermelon cheaper than the unhealthier options, that make frontal pack available so that you can really know what you're eating and understand that that's loaded with sugar. And I think my other key message is this is a rights issue. It really is a rights issue. How do we create a social movement that empowers people to feel this is their right? So those would be like the two things that I would like to put out there.
Thank you, Dr. Prieto. And Professor St. John?
Well, the last has a difficult task, but I would like to focus is on COVID. Everything is COVID. I'd like to, at a national level, for some awareness to be created again. Things were going reasonably before. Everybody knows 1 in 3 children are overweight and obese. Let us try to get some overall action again. Strict rules around marketing, especially in the school settings. Policy, as mentioned by some other speakers, policy implementation, legislation, be serious, and Caribbean governments to be held accountable for all those memorandums of understanding that they've signed dating back to the Chagaramas and various places they have been and signed these, not to have the papers just lying on the shelf gathering dust, because COVID is here to stay. Who knows when we'll have a vaccine? Obesity and overweight are just escalating. We've had a serious impact in the last number of months, and we need to pick ourselves up, dust ourselves off, and continue again.
Thank you, Professor St. John. And Dr. Soares-Winter.
Hi again. Yeah, so because we have to understand what our underlying risk factors are already, it really is important for us to manage our weight and ensure that the clinical management of those illnesses are controlled. It's really to be mindful of what we're eating, recognizing the financial aspects of our food purchasing, avoiding stockpiling. You know that until food labeling regulations are in place, it's still important that you can become aware of how to read food labels, engage in new activities, engage in your community, get involved in schools. And the reality is we do have a lot of online resources because it's all new to us. But most ministries of health or health advocacy groups here in the Caribbean, we do have quite a bit of information online for consumers to be able to access, because really and truly, we do need to become more self-sufficient and get engaged in that policy development process, as was mentioned before, because it is really our right as consumers to demand healthy foods and environment.
Thank you. So I'd like to thank all of the panelists, and just in closing, underscore that, we knew at the outset, researchers, public health community, they signaled the alarm that there was a potential problem with COVID that may lead to obesity and overweight. And we're seeing that being borne out. We've heard the evidence today. And we know that what we eat matters. We know that unhealthy diets now pose a greater risk to morbidity and mortality than unsafe sex, alcohol, drug, and tobacco use combined. And in the Caribbean, we know that we have some of the highest rates of adult and childhood obesity and some of the highest rates of diabetes and other NCDs across the world. And we know that COVID has threatened to worsen the situation. A study just released from the University of North Carolina, led by researcher Dr. Barry Popkin, found that obesity doubles the risk of hospital treatment from COVID-19 and increases the risk of dying by nearly 50%. And we know that obesity increases the risk of NCDs, such as diabetes, cancer, and cardiovascular disease. So, I think we've all recognized that COVID has really underscored or demonstrated that our governments have, in a sense, failed to create this environment which supports healthy eating, which supports reduced NCDs, and we really need to get serious about food security and our food systems. And our panelists have underscored that there are policies which are tried and tested. The WHO best buys and recommended interventions are evidence-based, and our policymakers, as Professor St. John has said, have committed to these. So we really need to get moving and get on with implementation of them and work together through a whole of society approach, with the population demonstrating this is their right and demanding these policies, and policymakers demonstrating not just political will, but political courage to move forward with the implementation of these policies. So I'd like to thank again the Heart and Stroke Foundation of Barbados, the Heart Foundation of Jamaica, our wonderful panelists, and all of you who tuned in for this webinar. We're now almost 10 minutes over time, so thanks for bearing with us. Please tune in for the rest of our webinars. We will be posting this on our website and through our roundup. And thanks again, and have a wonderful day and enjoy the rest of your week.